Hello, everyone, and thanks for tuning in to our Rockstar Women with MS expert call series for MS Awareness Week. Really glad that you could join us. We've got some really great experts this week. And today I'm speaking with Michael Zervas, who is a doctor of physical therapy, a neurologic clinical specialist who does inpatient rehab in Manhattan. And hi, Michael. Thanks so much for taking the time to interview with us today and answer some questions for us.
Hi, Lisa. I just want to say thanks for having me on. Really happy to talk with you today.
Now, one of the reasons I wanted to speak with you is that even though it's starting to be recognized now that it's important to have a physical therapist as part of our MS care teams, a lot of people are not being referred to physical therapists by their doctors, by their neurologists. Sometimes it's not even mentioned, and a lot of MS patients really haven't heard much about the benefits of physical therapy. They don't know much about it at all. So I wanted to ask you first, just in general, what are some of the benefits of physical therapy for MS patients?
Yeah, I think this is a great question, Lisa. I think, unfortunately, it's only really kind of starting to be recognized that physical therapy is really an essential part of the care for patients with MS. I mean, we've certainly come a long way from not being recommended very much to being recommended more, but it's still an uphill battle. Physical therapists are really the experts in mobility, and when we really think of MS, it is essentially a disease of mobility. So when patients receive a diagnosis of MS, it's very important that they go and see a PT, even if their symptoms are considered mild by their physician. By seeing a PT during the early stages, the PT can get baseline information, especially in the areas of your walking, your strength, your balance, your fatigue, as well as your endurance, as these are common areas that can become worse over time. And even if there are only really subtle changes, being able to provide individuals with specific exercises, programs, or just lifestyle recommendations are very important. If someone, on the other hand, has been living with MS for a long time, it's still never really too late to see a PT. We perform our own evaluations, which are distinctive from our physician colleagues, and tailor our treatments and our recommendations based upon our professional judgment. At the same time, we also take into consideration the patient's goals and their interests to make their care more meaningful. I think lastly, another area that PTs spend a lot of time with is in the area of education. This really cannot be overstated. There's only so much that we can do during your one-on-one sessions, so it's important to communicate our recommendations, which should always, always, always include the need to incorporate regular exercise into your routine after a diagnosis of MS has been made. Exercise is absolutely essential to combating the disease, regardless of whatever level of disability someone has.
Well, that's great. That sounds really comprehensive. And what really is important there is what you said about both educating the MS patient and having them so involved in their care and talking about mobility and improvement. I think a lot of times we find, and I have found this in a couple of instances, we find that in general, in our doctor's offices, there's not necessarily that emphasis on improvement. There's that, well, we just want to keep you stable and maybe you won't get worse and hopefully you don't get worse. And that can be kind of discouraging. So it really does sound like if you have a PT as part of your team, there's that hope, there's that encouragement of, no, there are things that we can work on here, and there can be improvement, or at least we can work at it. I think that's really important for people to hear. And in keeping with that, I just wanted to ask, there are very specific symptoms that people have with MS, and sometimes it's referred to as a snowflake disease because there are no two cases that are exactly the same. But there are several symptoms that physical therapy can help with. Like for me, for example, spasticity is a huge problem, and physical therapy has been really helpful for that. What are some of the other MS-specific issues that PT can help with?
Yeah, I think you bring up a lot of really good points there, Lisa. I think there are definitely some common issues that patients with MS face. One of them, for example, is having decreased strength in one of the muscles in front of the ankle, and that muscle is the tibialis anterior. And if that is affected and is weak, it can cause something called foot drop, which can result in either minimal to severe difficulty with taking steps, because that's the muscle that helps keep your foot up when you walk. And if it's weak, you can catch your foot, and the most common result of this is falls that are very likely to happen. A PT can help provide you with some exercises to help strengthen the leg, but in cases where the muscle is very weak, they can also provide recommendations for other things such as equipment like ankle braces, as that could significantly improve someone's walking quality, their distance, and their safety. In addition, people's balance can become severely affected, resulting in decreased walking, whether that's outdoors and community, as well as their walking distance, and can also result in falls. And this is important because, one, obviously we don't want people falling, but someone's balance can be affected, but their strength might actually be quite okay. So it would be important that a PT can really kind of take a look at your balance, and it's sometimes a great first start to tackle this issue. And balance is, like many other things, of course, is complicated. But it's important to understand that balance and having good balance is not necessarily just being able to stand on one leg as long as you can. There can be specific areas that you struggle with, which really is kind of the job of the therapist to figure out, and from there, providing exercises that are really tailored to you to help improve your stability with whatever activities it is that are challenging for you. Fatigue is another extremely common, if not the most commonly reported symptom in multiple sclerosis. And this can be very debilitating, especially when it comes to walking. So feeling exhausted at the start of the day or after doing just, a small amount of activities can make a lot of the recommendations the therapist says difficult to take into consideration. But luckily, there are some interesting and novel ways that PTs can help get around this issue, and that can be by using different pacing strategies as well as other different treatment modalities. And again, as I said, things can get complicated, so it's important to really, have good communication with your therapist on your symptoms and what your difficulties are. That way the therapist can really provide the recommendations that are really best for you. Because as you said, Lisa, if you've met one patient with MS, you've met one patient with MS. It's not something that everyone is definitely different and unique. And I think therapists who are accustomed and experienced working with patients with MS do recognize that. So that's definitely important.
Right. And actually, one of our listeners had asked me specifically, and it sounds like you kind of touched on it there. She had asked because she was having trouble with one of her legs, not both, but she was having trouble walking, and she felt like her doctor really wasn't helpful with that, and she had seen an orthopedic person who didn't really seem interested in the root cause of that. She said he didn't even watch her walk, And she was specifically wondering whether a physical therapist could help with that, like whether a physical therapist could recognize whether something might be MS related as opposed to orthopedics.
Yeah, I think that's a great question. I think as physical therapists, one of the things that we use a lot of is our eyes, and we do a lot of observation. So if this individual feels that something feels off to them, either it just feels off or they think it looks off, physical therapists can definitely assess someone's walking. And, as I mentioned before, we also do our own evaluations, which are sometimes very different and distinct from our physician colleagues. I would say that to see a PT and that they can really kind of look at your walking and, maybe help determine whether this might be something neurological, whether it's something orthopedic, but something that we definitely do look at pretty closely. And if it's something that you have felt has changed and not much reason why, then I think it's definitely something a therapist would probably be more than happy to look at. We look at walking all the time, and that's one of the areas that we're trained in. So, by all means, I definitely speak to a therapist then.
That's great. Now, one thing that I've been really wanting to ask you about is that you were conducting a study about maximal strength training in MS, which is absolutely fascinating. Can you explain to us a little bit about why you started that study, what it was about, and what the findings were?
Yeah, sure. I'd love to. So when I was still a PT student, this was back in Hunter College, I was part of a research group that examined the effects of what we were calling maximal strength training. And it's basically just exercising using really heavy weights, and we used a leg press machine. And the goal was to see if there would be any changes in patients with MS, their lower body strength, so their legs, but also if there would be changes to their balance and their walking distance. It was an interesting idea that one of the professors there, one of my mentors, Dr. Herb Kropatkin, was curious about examining this because we know that patients with MS commonly report fatigue, and having high levels of fatigue, you would think, well, I wouldn't really be able to do very much because if I'm lifting heavy weights, I'll just be so tired and I won't be able to do anything else. But interestingly, no one really examined that. So we were looking to see, well, could they tolerate the heavier weights? Because a lot of the other research in other neurological populations shows that doing heavier weights is actually good for the nervous system and good for sort of recovery and getting stronger and improving walking. So it ended up being a smaller study with just under 10 participants, but the results were actually quite positive, with participants getting stronger, improving their balance, as well as walking further with the tests that we used. So since then, we've actually started up another project that's very similar, but includes some different tests and more exercises, as well as more subjects. I think one of the biggest takeaways from the research, though, was that no one actually got hurt, and no one actually stopped the study because they could not tolerate the exercise or the heavy weights. In fact, almost all the participants were extremely surprised with how much they were able to lift because they were not used to going all out, so to speak. Now, I say this not to tell people who are listening, well, everyone should go to the gym and just start lifting the heaviest weights that they can without any supervision or guidance from a therapist. No. I think that the takeaway here is that it seems like patients with MS are capable of doing a lot more than what they thought possible, as well as most likely some therapists, and that these patients felt great doing it. And I think that is really a powerful message, both for the PTs and the profession and or for our patients, because it helps justify pushing the people that we work with hard like any other neurologic diagnosis without these apprehensions or fears of making them worse or creating exacerbations, because it just simply does not happen.
Well, that's really encouraging because, yeah, I think a lot of times we're not aware of what we actually can do. And a lot of the times it's just because we're afraid, honestly. Or we've decided, well, I can't do this, or I must be weak because I have difficulty walking. And maybe it's not actually related to strength and we're not aware of that. So that's definitely very encouraging news. And I guess related to that, the idea of, oh, this is what I can and can't do, I'm weak or whatever, some of us with MS, probably a lot of us with MS, haven't been particularly physically active for a while, either because symptoms have made it difficult or the symptoms have made us fearful, of falling, things like that. So we haven't been moving around or exercising much. And being in poor physical condition can make the idea of starting PT a bit intimidating. And what words of encouragement do you have for those of us who might be feeling like that?
Yeah, I think that's a common thing that I've heard and my colleagues have heard. And I would say, as I mentioned, I think at the start of the interview, is that it's really never, ever too late, really, to start a physical therapy program. We understand that it might be scary and difficult to start, especially if you've had some changes in the way that you're feeling or the way that you're moving or if you've had falls. But it's absolutely essential to take that first step, to find a therapist and find a place that fits your needs, and really start there. By talking with your therapist, you can come up with a plan together. And remember, it's always really a team effort here. It shouldn't just be a one-way street, but the role of the therapist is to help guide you in the right direction and provide the right recommendations, but you're definitely an active player in your care. In addition, I think it's helpful to describe some of your interests and what goals you have in mind. Are there things that you want to be able to do that you're having more difficulty with more recently? And it doesn't have to be something big. It can be something small or something that's really just kind of meaningful and personal to you. I think lastly, us PTs, we want to support you. We want to help improve your confidence, especially when it comes to anything mobility-wise. So starting up with a PT can help, just kind of jumpstart your physical fitness, which has so many benefits, not only for MS, but also just for your overall health. And it's important to realize that not everyone does exercise the same way, and that's perfectly okay. Okay? You do not have to compare yourself to those around you, but instead, you can just find something that works for you, that you enjoy, and that you can benefit from.
Wow, that actually is encouraging. So for someone with MS who is interested in starting physical therapy, and I'm sure a lot of people will be, especially after hearing this interview, what suggestions do you have about finding a physical therapist?
Yeah, I think that's sometimes, it can be quite a bit of a challenge because there's lots of PT clinics, but who should you go see? So there's definitely a couple of very good resources that I would recommend. The first is the National MS Society. First, I think that their website is really great. It's easy to provide providers. I actually went on just to make sure that I give people the right information. But all you have to do is really just type in find a doctor in the National MS Society, and you're brought to a page where you can click healthcare providers, and then physical therapists should come up. From there, you just enter your location info, and you should get a list of individual providers, as well as some larger organizations. And some of those larger organizations have comprehensive MS programs, which can be helpful, especially if you have other areas that you'd like to explore working with other clinicians. Another way to find PT specifically is to go through the American Physical Therapy Association's website. And the easiest way for that is really just to type into any search engine, find a PT. and it brings you right there. After entering your zip code or your state, you can then search for therapists that treat specifically in neurological care. Some may also have board certifications in neurological physical therapy, which some that you may see as well. But the main takeaway here is to pay attention to where you go and who you see. So whether that's looking up online or speaking to a clinic on the phone, because if you have MS and you're there to treat your MS, you want to make sure that you're seeing a therapist that has experience working with patients with neurologic diagnoses, and ideally MS. You wouldn't go to see the dermatologist if you broke a bone, so the same principle really is applying to PTs now, where therapists are really kind of specializing in a model that is, getting closer to kind of the medical model. So if you have an orthopedic issue, you're probably seeing an orthopedic PT, versus if you have a neurological issue, seeing a neurological trained PT is probably your best bet. So I think those are really kind of my main recommendations. But I would say if all else fails, definitely get in touch with Lisa here, as I know that she's had her own experiences working with lots of different therapists across the spectrum, and I'm sure that she could certainly shed some light on some things to be on the lookout for.
Yes, things to make sure you run away if you do see versus things that you're going to be definitely happy with. Yeah, absolutely. But Thank you so much. That was a wealth of information. I really appreciate your sharing that with us, Michael. And, now that you're in the fold, I may have to invite you for another interview at some point again, if you're up for it.
Oh boy. No, I'd be more than happy to. Again, thanks so much for having me talk with you. I'd love to support any way possible.
Okay, thank you so much. We'll speak with you soon.
Take care, Lisa.